Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on the COVID-19 pandemic for the United States for the week of September 27th, 2020. As you know, this pandemic began presumably in China in the late 2019. It really didn't have a great impact on the United States until March and April. In early March, there had been about a dozen deaths in our country, but the numbers have been going up very quickly since then, consistently, such that this week we have passed 200,000 deaths and about a little over 7 million confirmed cases and about a 2.5% increase in the past week. I always like to point out that there are 10 leading causes of death in the United States that account for about 3/4 of all of our deaths. And if you look at COVID-19 for the first 8 months of this year, clearly in third place. This is a very serious pandemic. It's one of the leading causes of death in our country right now, and it hasn't gone away. If you look at cases, it grew very quickly in March and April. Then there was a second curve, and now it looks like we may be seeing a third increase in cases. I like to look at deaths, and if you look at deaths again, early March and April, great increase in the number of daily deaths. Then it seems to have come down, gone back up, and may have come back down again, or maybe leveling off and possibly even going up. So again, nothing to be trifling with. Always important to remember that this, just like in the world, in the United States, this isn't happening everywhere all at once. This is the U.S. pattern, but there are states like New York, New Jersey, Rhode Island, Massachusetts that saw a very quick increase early on and then have basically been leveling off in the total number of deaths. Conversely, there's states like Virginia that have seemed to be slowing down, and then states like Tennessee and Florida where the numbers continue to go up. If you look at the week-to-week growth rate, this is sort of how much, so early on, it was almost 100%. We almost get twice as many deaths 1 week from the week before. It's been coming down in about 2.5%, which is one of the lowest numbers we've seen, which is a good thing. And as you can see on this map, this one shows all of the cases reported anywhere in the U.S. from the beginning, and then as it's going to transition to show just those in the last 2 weeks. And what you can see is a moving trend from urban areas to rural areas. And again, this is this idea of a pandemic and epidemic being like ripples in a pond. That clearly started for us in the urban Northeast. It's now spreading out into the Midwest especially, and perhaps into more rural areas. So we're still in the midst of the evolving pandemic. We're starting to see some parts of our country that appear to be slowing down, as we've seen in Europe and other parts of the world. Hopefully that'll be a trend that continues. But for much of the U.S., it continues to be a major pandemic, a major cause of death. There's a great deal more information about COVID-19 on the College of Public Health website. If you know folks who'd like to be added to this mailing list, please let Jan Stork know. As always, I'd like to thank Melissa White for updating this week's slides and Dara Young for editing, producing, and posting them. Importantly, if you have any questions, comments, concerns about these videos, please let me know. If you have any questions about the pandemic itself, I'd be happy to try to address them for you. I look forward to hearing from you. Thank you very much.